We are exactly at the stroke of 11:30 in the morning. Time for us to move on to the next keynote address. We are back to CAD prevention and regression, the 3D approach. This would also feature the keynote address for 13 minutes, followed by 2 minutes for the chair observation, without any questions from the floor. The invited speaker is none other than the organizing secretary, the Secretary General of this 7th World Congress, Dr. Satish Gupta. Before Dr. Gupta takes over the podium, may I invite Drs. Manju Gupta, Ajay Kumar Pandey, Professor Rick Levy, and Professor Inaze Inas to please chair this very important keynote address. I would request the chairpersons to invite Dr. Gupta and set the proceedings in progress. Over to you, gentlemen. Thank you.
Respected chairpersons, good morning colleagues, Om Shanti. Today I will be presenting you CAD prevention regression 3D healthcare approach. So my first slides, which I just run over the slide because the main topic is 3D. What most of the things you will be knowing, I'll just focus on the last few 20 slides. First few slides I just quickly run through. This is our hospital, Mount Abu. This is hospital here. This is Shantiman, where you are. And you know, the modern healthcare is just one dimensional. Whatever we do is just focuses on the body. Whatever research or whatever we do in all the medical schools, there is no teaching about neither about the mind nor about the soul. While the human being is not only body, it's something more than that. And the modern breakthroughs in medicines are new drugs, laser, gene therapy, stem cell therapy, high-tech surgical procedures. But how many people can afford it, especially a country like India and many developing countries? But the real breakthrough is change in lifestyle. It is as powerful as drugs and surgery, and sometimes even more powerful. 5 things you have to tackle. How we respond to stress. These are our own choices. How we respond to stress, what we eat, smoke or not, exercise or not. Sorry. And quality of relationships and support systems. And one paper in 2009 has shown us that on this actually there was a Nobel Prize in medicine. Meditation, diet and lifestyle changes may even change gene expression in hundreds of genes in only a few months. In Lancet, this paper came, genes associated with CAD, cancer, obesity, hypertension, inflammation were down-regulated or turned off, whereas protective genes were turned on or upregulated. Our healthcare system is basically a disease care system. It is not a healthcare system. I just like in 2008, US spent about $2.5 trillion, and out of which 95% was spent to treat the disease. Only 5% was spent to sort of prevent the disease. The mechanism, which is accepted mechanism all over the world by Rosansky and Blumenthal, psychological stressors like type A behavior, anxiety, depression, anger, isolation, chronic life stresses, they lead to behavioral risk factors like smoking, poor diet habits, poor exercise habits, poor sleep habits, and poor adherence to treatment regimens. They lead to progression of atherosclerosis and triggering of cardiac events. If we do not change 1 and 2, then we have recurrent cardiac events. This is what happens when you are in hurry, anxiety, sensitive behavior, not able to ventilate. And then gym is not the answer, and these type of foods do not help you. Even fish doesn't help you in the right way. And like, I just give one figures of American Heart Association. They had 1.3 million angioplasties in 2006, and cost was about $104 billion. It's about, they spent about $60 billion in carrying out about 1.3 million angioplasties and about 4.5 lakh bypass surgeries, $44 billion. And if you see here, The figures in 2010 were, in India, 47 million people suffering from heart disease, CAD, and less than 50 years, it was 28 million. This is Dr. Nasena's, we've taken from you. And deaths below 50 years, 1.1 million. If you project it to 2015, we can see the figures further approaching, very significantly. 2010 status, 12 to 14% of urban Indians are suffering from CAD, as compared to rural Indians, only 6 to 7%. So, there's twofold urban-rural gradient, same genetic pool. That means there's a powerful impact of lifestyle factors, superimposed over same genetic susceptibility. And there's a study by Ramchandran et al. I just want to tell you what doctors are doing, how doctors are as compared to general population. You can see this, general population versus doctors, obesity 55% versus 35.8%, hypertension higher, diabetes almost same, metabolic syndrome higher. CAD we don't have the figures. So doctors are really not taking good care of their health. Doctors also need to take care of their health. And whatever we do, modern state of art, heart care is PCI with stenting, BMS or DES, CABG, statins. It is all these things are essentially palliative. They do not address the root cause. And root cause is genetic factors, mental stress, diet, exercise, sleep, and tobacco. It's only one dimensional. While CAD is a psychosomatic disease, it is a lifestyle disease. The need of the hour is, there's certain studies like Courage trial, everyone knows about it, how it has shown that PCI does not reduce the risk of death, MI or major events when added to optimal medical therapy. What is optimal medical therapy? Intensive pharmacological therapy plus lifestyle intervention. More than 2,000 patients, follow-up about 4.6 years. Like you can see the events, almost same. And median time to next intervention is about 10 months. OAT trial, again more than 2,000 patients. It also concludes PCI did not reduce the occurrence of death, reinfarction or heart failure. And there was a trend towards excessive infarction during 4 years of follow-up in stable patients. Okay, primary PCI is fine, but in stable patients, if we go for intervention, you can see the trend is more, right? There's a trend towards more non-fatal infarctions in the PCI group. Then Maslow trial, comparing CABG, angioplasty and medical therapy, you can see hardly there is any, except for the additional intervention, there's no significance in any of these parameters. So Maslow trial found no difference in cardiac-related death or overall mortality in patients treated with CABG, PCI or medical therapy during 5 years of follow-up. Routine strategy of PCI for patients with stable multivessel disease is not superior to CABG or medical therapy and may be associated with higher need for repeat revascularization. Most patients with stable multivessel disease can be safely managed with optimal medical therapy. PCR angioplasty bypass is appropriate if symptoms are not adequately controlled by aggressive medical therapy, comprehensive risk factor modification and lifestyle intervention. I think 95% of patients can be managed just with this approach. So despite cause, angioplasty and stent do not prolong life or even prevent heart attacks in stable patients. Coronary bypass surgery prolongs life in less than 3% of patients at 5 years follow-up, but at 10 years, this was not observed. While if you change the lifestyle, it prevents or reverses not just heart disease, but also many chronic diseases. We have seen hypertension comes under control with less medicine. Diabetes, we are able to stop insulin. Insulin sensitivity improves. Almost every disease, GRD improves, back pain improves, cervical spondylosis improves. Everything. Migraine disappears. So many things happen from top to bottom, from head to toe. Everything almost improves. Well-known milestone study, inter-heart study. More than 30,000 men and women. Modification risk factors including mental stress can decrease the prevalence of CAD. Changing lifestyle could prevent at least 90% of all heart disease. I think this is all, it is modifiable definitely with lifestyle and even with drugs. CAD, metabolic syndrome, or hypertension, obesity, diabetes, all are stress related or psychosomatic and all lifestyle diseases. CAD has now become the most predictable, most treatable and most preventable of all chronic diseases. Type 2 diabetes and CAD seem to share risk factors including obesity and dyslipidemia and might even share etiology. Again from Dr. NS. What is the solution? You all know about biomedical model of health, then biopsychosocial model of health, And then came the biopsychosocial spiritual model of health. And then in the 21st century, most of us, what we can offer consists of providing relief and comfort. Growing evidence for beneficial role of spirituality in health and well-being suggests promising opportunities for innovation in providing relief and comfort. Association of American medical colleges, the WHO, and the Joint Commission on JECO now includes spirituality in medical practice and education. In addition, many have called for expansion of Angel's biopsychosocial model for health care to biopsycho-spiritual model of health. So here basically we are using this model for understanding, it requires understanding physical, mental and spiritual suffering, and spiritual care plays a crucial role in providing relief and comfort always. And this 3D healthcare model was introduced in 2006 by our group. There's a lot of articles now, spirituality and medicine, impact of spiritual symptoms by Cathedral et al. This 3H model, you know about Maslow's triangle, spirit, mind and body, how environment and society, social factors affect the mind and the body. Like this is a individual and the physician and the patient, right? Presently we are just addressing on the body level, drugs, surgery and the physiotherapy. At mental level we can do counseling, cognitive therapy, and at the spiritual level we can do spiritual counseling, right? And in addition, compassion, patience, and then meditation helps both doctor as well as the patient. I think I just skip this. Health we all know. This is the Oxford Dictionary definition, and heal, die. And this is what the need of the hour is: 3D healthcare, which addresses genetic factors, it addresses mental factors, and a person develops strong willpower to adhere to a healthy diet, exercise, sleep habits, and say no to tobacco use. What is three-dimensional healthcare? In which spirituality and science are adequately combined. Yoga means huge. Three-dimensional healthcare means harmony at all the levels. This is the practical model of this healthcare, in which the Global Hospital, Mount Abu and Defense, DRDO we combined, and Ministry of Health, various hospitals from Delhi, Mumbai and Ahmedabad collaborated with us. This paper has been published in Indian Heart Journal, and it's a multidisciplinary study. And we had this Abu Healthy Heart trial, which is coming for publication very soon. Healthy lifestyle group and control group. And it's same, everything was same except for the stress management. Diet was same, exercise was same, usual medical care. Angiography was repeated at 1 year. And see, over 80% patients had DVD or TVD. And see the psychological stressors, how they got modified. Type A behavior significantly modified in healthy lifestyle group. Anxiety significantly modified. Depression. Anger also significantly modified. Healthy lifestyle change, better. Overall feeling well, much better. In control group, hardly no change. See, the anger has increased little bit, not significant, but it means that you can't just by telling yourself, I will not get angry, doesn't solve the problem. Anger is, you have to, empower the person by peace, love and happiness. And the behavioral risk factors, they all improved in the healthy lifestyle group. And EEG, you can see the EEG. All these pictures, I've placed there, in the spiritual exhibition. You can go and see all these things. See the baseline lifestyle and the after lifestyle procedure. You can see the alpha rhythm improving, delta rhythm improving, beta rhythm going down, and even delta rhythm improving. I think that's it. So I think my time is over, and you will be able to see all these presentations in the exhibition. All these are there. So in the end, I conclude by saying that the present approach requires three-dimensional healthcare: spiritual, mental, and physical. It's now, we have done this study, and we are working for last more than 14 and a half years, and we have more than 3,500 patients into the study, and they all are, improved a lot. All the patients, all the Dilwalas, who are looking after you in different places, different kitchen and where you're staying, are all patients, all CAD patients who have benefited from this program, who opened their blocks. Thank you so much. I just call, they're sitting here. Can you show them your faces? Come, just in front. Come, rush. Time is over. Yeah. Just few of them, you can see just their faces, how these people have been, but you just be here. Time is not there. Huh? Just all these Many of them are doctors, qualified orthopedic surgeons, physicians, cardiologists, who all are helping you in managing different aspects of this conference. Om Shanti. Thank you.
I really enjoyed the presentation, and I must congratulate Dr. Gupta for an excellent overview. It's often said that genetics loads the gun, which is true for Indians, but it is the environment or the lifestyle that pull the trigger. Over the last 50 years, India has seen an exploding rate of premature heart disease, which is twice higher in the urban areas. It has increased about 300% in the last 30 years. Now it's increasing about 6 to 8% per year. And also he has quoted me and showed that coronary artery disease has now become the most predictable, the most preventable, and the most treatable of all chronic diseases. In fact, there is no other disease more predictable, preventable, and treatable than coronary artery disease. There is no reason to suspect that does not apply to Indians also. Finland decreased the heart disease rates by 80% in the last 30 years. It's coming down by 5% per year. US has decreased the heart disease rate by about 70% in the last 30 years. It's coming down 5% per year, whereas it is increasing 6% per year. So there is an urgent need to aggressively modify the risk factors, and the Indo-US Health Summit has recommended specific lower threshold of intervention. You can actually see it in the website. But the lifestyle has an important role to play, especially when you look at the urban-rural gradient. And you are doing a commendable job. Keep doing. Yeah. Congratulations.
I also would like to thank Dr. Satish Gupta for an excellent presentation. There's some interesting things here. You know, a lot of this we've known. I was thinking back as you were talking how long ago it is that Dean Ornish started showing us these things, and how long it has taken us to start to integrate these things. Now, 90% of CAD being able to be managed by lifestyle changes due to these psychological and psychosocial stressors. And yet we see the doctors themselves are not living properly to take care of themselves. So let's say I've got CAD. Do I really want to go to you when you look less healthy even than I? You know, there's some issues here about changing how we are as individual people. There is a new type of doctor emerging. I have seen dialogue beginning. There's been very conventional doctors who have been willing to have nothing to do with lifestyle and psychosocial role, but they're gradually being modified along the way now by people like Dr. Gupta. A new age is coming, and Dr. Gupta is a perfect example of it. Thank you so much, sir.
I think, ladies and gentlemen, you will agree with me that this was the most powerful data which has been published in Indian Heart Journal. It took almost 4.5 years to get this data published. And it is 8 years duration data. The whole paper was sent to Naveen for a review. And I'm sure he took the help of some preventive cardiologist. It was validated, and we had very, very strong comments about this. We feel highly privileged that an Indian data has gone to the global scenario in the form of Dean Ornish data. Dean Ornish has just written a book, but the data is very limited. Here the data, not only pilot data, a follow-up data with angiograms and a complete documentation. I think this is something very great. Manchanda has also done a lot of work in Delhi, but the data is limited and there is no long-term follow-up. But his data is also very powerful. Let's give a big hand to Satish for his outstanding contribution, and I'll request both the chairperson to put a medallion of this keynote address.
Ladies and gentlemen, we'd like to thank the chairpersons of this session and to Dr. Gupta for delivering this keynote address.